ELLORIN-IGROS. On behalf of my colleagues, I'll be presenting our paper entitled Hospital Bed Scheduling and Capacity Management. Our paper explains the importance of capacity planning to help institutions to have the capabilities to respond to the rate of demand experiences. Identifying bed capacity is essential in managing highly specialized and costly resources. Over the years, it has been a worldwide challenge to provide quality health services. Many limitations hinder universal access to excellent facilities such as financial resources, education of skilled personnel, and fair distribution of benefits. The study deals with the healthcare system in the Philippines as the country is still struggling, especially with the current global health crisis. The Philippines is considered as one of the countries with the worst COVID-19 outbreaks in the Southeast Asia. And the country struggles with the surge of COVID-19 patients. Hospitals must also consider other illnesses that require medical attention. Based on Figure 1, the country's statistics are comparable with the poorest countries in the world. Compared with other African Asian nations, the Philippines is considered to have a low bed-to-population ratio. The Philippine Health Facility Development Plan articulates that the health program of the country targets to increase its investments in health facilities. Accreditation of hospitals are ranked based on their performance and capacity to provide health care, comparing with all regions in the Philippines. The National Capital Region has the most significant number of Level 3 accredited hospitals. Moreover, the bed occupancy rate, or BOR, is computed to determine if the hospital has sufficient beds to accommodate patients. A high BOR means that the number of patients is greater than the available number of hospital beds. As seen in Figure 3, the Philippines is currently experiencing a surge of patients, indicating a lack of hospital beds. For our problem statement, considering the current pandemic situation in the Philippines, how will hospitals implement good capacity planning? The model formulation should demonstrate bed capacity optimization through linear integer programming to minimize the operating costs and optimize their resources. The Philippine hospitals had an increasing bed occupancy rate in 2020 and 2021 due to the rising cases of COVID-19. Based on the data gathered, this study aims to provide a solution in addressing bed assignments amidst the pandemic through mathematical programming. Our literature review focused on the study of 3 authors, Bakuk, Ataulahi, and Wang. This section explains different studies and investigations related to mathematical programming and simulation in hospital bed resources capacity planning. According to Ben Bakuk, bed allocation can be categorized considering the severity of the patient's illnesses. According to the mentioned cases, they have proposed a decision tool for hospital bed planning. The author's model was optimized through 3 softwares, GLPK, Lingo, and CPLEX. On the other hand, Ataulahi proposed a goal programming model approach for solving reallocation beds in a hospital by considering the total number of beds, nurse working hours, waiting time, definite bed allocation to the patient, and bed allocation to the ward. Lastly, another study utilized a mathematical model based on a dynamic dispatching approach for bed resources allocation, considering hospitalization demands, bed capacity, and income constraints. This model was proposed by Wang and his colleagues. In this study, linear integer programming is utilized to determine the optimal solution for bed scheduling. Considering previous programming models, our study utilized linear integer programming to determine the optimal solution for bed scheduling. The decision problem for our paper is to coordinate the utilization of multifold resources within the hospital maximally. In our case, the multifold resources are doctors, nurses, beds, and rooms. The most appropriate model to be created is a linear integer programming problem. As shown in the presentation, the set and decision variables nomenclature for the model is categorized by department, doctors, nurses, available beds, rooms, medical equipment, and technicians. Parameters considered are as follows. The objective function minimizes the total operating cost of the hospital while utilizing its resources. It is the summation of the cost of doctors, nurses, technicians, and all other medical equipment. Constraints used in the study are as follows. Constraint 2 shows that the number of doctors should not be greater than the maximum number of doctors that can be allocated to each department. Constraint 3 indicates that the number of nurses should not be greater than the maximum number of nurses that can be allocated on each department, while constraint 4 ensures that the number of beds should not be greater than the maximum number of beds that can be allocated to each department. Constraint 5 to 8 signifies that the number of resources should be greater than its minimum value of allocation. Constraint 9 states that the budget spent should not be greater than the fund provided. And lastly, constraint 10 signifies that the total number of doctors, nurses, technicians, beds, and medical equipment shall never be negative. The tabulated data is from one of the hospitals located in National Capital Region in the Philippines, the Quirino Memorial Medical Center. The table shows that the maximum number of hospital personnel that can be assigned to each department. Next, the information shown is the tabulated figures of the minimum number of hospital personnel that can be assigned to each department. The following data is the assumed cost of salary for each hospital personnel. Next, these are the average cost of assigned beds in the Philippines. Finally, the tabulated cost indicates the average cost of assigned beds in a particular department. This study uses a mathematical programming exact method as an effort to get optimal solution for a bed scheduling and capacity management problem. It is implemented using AMPL mathematical programming language and Gurobi, which is a commercial mathematical problem solver. Here are the generated results. Based on the gathered data and implementation of model, minimum values are generated. As shown on the results, the optimal number of doctors for each type need to be allocated to each department. The program generated that the number of doctors being allocated is the minimum number of doctors that can be allocated at each department. Similar results pattern also shown in all cases regarding number of nurses and additional nurses to be added. The minimal cost is computed to be 16,182,148 pesos. According to the results, the minimum cost is attained when all parameters are at its minimum value. This will be the cost of minimum numbers of doctors, nurses, and beds that can be added in each department to cater the needs of hospital beds, not only due to COVID-19 virus, but also to maximize the capacity of hospitals to treat various illnesses. To conclude the report, bed allocation can help hospital management to plan and allocate budget for purchasing new beds and hiring additional personnel should severe resources shortage occur during pandemic. Constructing a model for hospital bed capacity planning is essential during pandemic. Hospital bed shortages cause some illnesses to be treated at home instead of a healthcare facility due to this dilemma, as COVID-19 infected persons have been the priority, especially those with severe symptoms. In this model, it was determined that for the hospital to be able to operate with additional doctors, nurses, and beds, the hospital may allot a minimum cost of 16,182,148 pesos. Using AMPL Gurobi, the additional resources for this objective was obtained. That ends our presentation. Thank you.
Thank you very much for the presentation. So any question